Good evening, everyone. I am Dr. Nalini Kaushik, and welcome to our first panel discussion as we observe October as Breast Cancer Awareness Month, which is an annual campaign to raise awareness about the impact of breast cancer. And our today's session is concentrated specifically on the state of Rajasthan. So, in 2022, International Agency for Research on Cancer showed, or it released statistics that showed breast cancer as a type of cancer, which has now undertaken lung cancer as the world's most common diagnosed cancer. With the number of mortalities now which are related to NCDs in India, the recent rise in the breast cancer cases is also worrisome. And as a result, timely diagnosis, establishment of standard treatment guidelines, funding for cancer research, adequate number of workforce, and creation of awareness for elimination of breast cancer related stigma are some of the areas of key intervention when it comes to cancer care. And in our today's session, we are going to be discussing some of these aspects more closely, but very specifically in the context of state of Rajasthan. And to do so, we are joined by a very esteemed panel of speakers. We have with us Dr. Lalit Mohan Sharma. He's a senior consultant hematologist and medical oncologist with the Department of Medical Oncology at Sri Ram Cancer Center, Mahatma Gandhi Hospital, Jaipur, Rajasthan. We have also with us Dr. Rajesh Gupta. He's the president of Rajasthan Cancer Foundation in Jaipur, and he's also the honorary consultant in SD Memorial Hospital Institute in Jaipur. We also have with us Dr. Arun Vashisht. He's a state program officer in non-communicable diseases department with the Department of Health and Family Welfare, Government of Rajasthan. Thank you so much to all three of you to be for sparing your time and being here with us today. So we will just start, with putting into perspective the landscape of breast cancer in the state of Rajasthan. And to do so, I'm going to be starting with Dr. Lalit Mohan and with Dr. Arun. Dr. Lalit, you had this wide experience, in the state of Rajasthan, and that too, with the most city hospital. So if you could just help us understand that, what have been your learnings when it comes to breast cancer incidence in Rajasthan, and what is people's willingness, to come forward for early screening?
So thank you so much, Dr. Nalini, for having me on board today. And this is very area of need, in fact, a need of art that we discuss about breast cancer, and it's special pertaining to Rajasthan. I am thankful to you that you have chosen Rajasthan for this discussion. So if we see total number of breast cancer cases, which we were seeing, say, 20 years before and 10 years before, the rapidly increasing number is a alarming thing that we are seeing more and more of breast cancer cases. And currently, given in any hospital, I feel that every third or fourth patient is coming to us with breast cancer. So the number is high. If we see overall statistics, it comes to around 15 or 18% of the total hospital load. If we see women, this has become one of the commonest cancer. When we started a clinical practice around 20 years back, it was cervical cancer, which was more common in rural areas than in Rajasthan. But nowadays, we are seeing more and more of breast cancer coming up as number one cancer. The alarming and most disturbing thing is that the age of breast cancer in Western world is in the fifth decade. But in India, in Rajasthan, we are seeing mainly in young women in the age of 30s or 40s. In fact, so it is almost one decade earlier as compared to Western world. Number two, we are seeing breast cancer cases, majority of cases are approaching us in advanced stage. Advanced means at least in stage 3 and partly in stage 4 also, like 15-20% we see in stage 4, where we cannot offer curative treatment for them. The other issues like breast cancer has got a taboo. There is lack of awareness, lack of knowledge. So the women, they do not go to the doctors easily. Female doctors are lacking and they are many times shy to go to male doctors. So usually the breast cancer diagnosis is delayed and they take help from here, there. Then comes the treatment related issue that many times they are scared of the surgical intervention. Breast will be removed. Sometimes they feel that surgery, we don't want to undergo surgery, you can offer any other treatment. So lack of communication, lack of knowledge, and lack of willingness to accept the treatment. And over and above, the financial crisis, financial aspect, that the breast cancer burden is huge and treatment is expensive. Of course, in Rajasthan government nowadays, we are having some government free schemes, Mukhyamantri Chiranjeevi Swasthya Yojana. So we are able to offer free treatment, but still women still are socially not as good as men, in fact, and still there is some difference in women and men. So again, women are less often brought to the hospital for aggressive treatment as compared to men. So these are few important points which I have highlighted.
Thank you so much, sir. And in fact, you have given us this entire spectrum of, the scenario of, what is happening currently in the state with respect to breast cancer. And I think one key point that, you mentioned or you reflected upon was the increasing rise, sudden rise, and that too in a specific, age group of women, which is very different from how it is happening or how is it being reflected at the global level, right? And actually, I think our today's discussion, I think that is going to be one of the major chunk of discussion that we're going to be having. But to put more perspective now, because you also mentioned a bit about the government aspect there, and what are the schemes that we have. I would like to bring in Dr. Arun here. So, Dr. Arun, I was actually looking at some of the data, recent data that showed breast cancer, in the state of Rajasthan, that amongst 16 and 1 lakh deaths, are happening, currently with respect to breast cancer in the state. And if we, most of these deaths actually, I think close to 20% of these deaths can be averted by early detection. Now, this is the statistics. We also know, like sir also mentioned, that there is a rampant increase in the rampant incidence of breast cancer cases. बट राजस्थान एक ऐसा भी स्टेट है जहाँ पे गवर्नमेंट ने बहुत फॉर सिंस मेनी डेकेड्स गवर्नमेंट ने वुमेन हेल्थ पे बहुत फोकस करा है एंड उसका रिजल्ट इन वेरियस पैरामीटर्स वी हैव सीन सो व्हाट डू you think in like can you help us understand that what exactly the government is doing when it comes to breast cancer, cancer care, and specifically women related cancer and breast cancer? Over to you, Dr. Arun.
Yeah. First of all, I would like to thanks to you, ma'am, to put me on say that under this national program and city program, there are two basically things which we are doing. One is the opportunity OPD based screening, and from last 3 years actually under Ayushman Bharat Health Wellness Center program, we are doing the population based screening for breast cancer also. We catering basically three common cancer which are oral, breast, and cervical. And breast cancer is now the #1 cancer in the females throughout the nations, and I think internationally also. So what we are doing under this program is we are training our staff, we are training our ashas, what is the cell breast examination, what is the clinical breast examination, as well as our community health workers, or ANMs, and our community health officers, CHOs also, which are newly recruited. We recruited 10,000 CHOs also. We are training, had trained them, ashas and ANMs are trained. Almost 80% of the staff, we have 55,000 ashas in the state, and we have approximately more than 30,000 ANMs in our state. More than 70% to 80% ANMs and ashas are trained for this. So in this program, what we do that on the population based survey and screening, we do the community based. Yeah. Early screening is very, very important for breast cancer diagnosis and all the things. Despite all the Lalit sir telling the social stigma and all the things are going, but still we are trying for the prevention of this, for the early screening, basically I must say, of the breast cancer. What we are doing that Asha go home to home and fill a checklist. We called it CBAC form, community based assessment checklist. That checklist have 4 or 5 symptoms related with the breast cancer.
Right.
When she go to the home in the village and the ward, she asks these symptoms ki, Bahanji, that sister, do you have these symptoms? Could you please come in the corner? Again, the social stigma will come, or limitation will come. And do you have any these symptoms? You can tell me. Then we can go to the nurse Banji and we can go to the doctor. First of all, we're doing this. Then again, at the time of screening, it's supposed to be done by ANM or community health officer. They again do the screening. At this time, we are not very emphasizing the cell breast examination. We give the priority to clinical breast examination. So we do the clinical breast examination of the female. If she told us that she have any symptoms or breast cancer, we do, and we refer them at the center. And the diagnosis facility available at district hospital and medical colleges. We in Jaipur, we have State Cancer Institute. We have all the types of therapies and treatment of cancer at State Cancer Institute, Jaipur. And we also giving the tertiary facilities, especially the diagnosis and the treatment facility, chemotherapy at all the district hospital of our state, So lady can take the treatment from there. And also we are in process of developing Jhalawad and Bikaner Medical College as our tertiary cancer care centers also.
Right.
We are in process of doing that.
Yeah.
So these are the things we are doing in our program at primary, secondary, and tertiary level. And but we have some limitations. The program have some limitations, and we are combating with this. Like when we say the screening, I can easily, everyone can say easily, कि भाई हम screening कर रहे हैं. We are doing screening of females. But how many females, when you counsel them and tell the importance, how many are ready?
Exactly. Yeah.
How many tell them? How many tell you, in spite of having the problem? How many tell you when Asha and Enam will ask you? How many will tell you? And how many are ready with do the screening? How many families are ready? Their families are ready. And then how many are accepting to refer?
Correct.
To refer and having the treatment.
Right.
Also social stigma and financial and other things.
Right.
So these are the things we are planning, how we can do better.
Right. Yeah. Thank you so much, Dr. Arun. Actually, on one hand, at the infrastructure level, at the policy programs level, we have seen that government of Rajasthan has always been very focused and, have made some really good programs. But at the same time, because just the last part that you said that, about the experience, because when it comes to early screening or routine screening, it has to also be a, population-induced demand as well. The motivation level of, of the population has to be adequate in order to make such programs more successful. And in fact, again, the Rajasthan level data that I was looking at, that I also cited a while ago, it also reflected that, despite that, the routine screening has been initiated in the state, less than 5% women have, so far undergone breast cancer examinations. I don't know how, reliable this data is, but if it is, it's just 5% women. And that also showed that, if this is, practiced more efficiently and regularly, around 60% of mortality can be, actually be averted here with routine screening. So, what do you think is a gap here?
In which aspect, Pam?
It is the routine screening that I'm talking about. Like you said that, at the programmatic level, all, structures are in place. We have the health system strengthening also going on. But if we look at the data, routine screening is still, the uptake of routine screening is still, not adequate. So is it only the stigma that, of breast cancer, or is it, any specific?
Oh, it's from both sides, from the demand side as well as from the supply side also. If we talk about OPDs from way to district hospital to a sub-center level, if I talk then the training, a particular training they needed for the clinical breast examination, but we trained them. But again, when you check the breast of a lady, breast clinical breast examination, you need a privacy,
Yeah.
and you need to understand the importance of the lady's life, which is on the risk because of breast cancer.
Right.
Many times, ANMs and CHO ask, any problem do you have, ma'am? Breast, do you have any problem? This is not called screening.
Yeah.
They will not have problem, or anybody not will have not problem, even doctor will not have problem until or unless it's not asked, it's not talk about the blood or the pain.
Yeah.
या तो खून दिखे हमको या हमको पेन हो, then we call it the problem, until or unless, and then it is come on the another stage of cancer. Metastasis will happen and we can't treat, or we can treat, then there are many problems with that. The thing is that we want to do the early screening. So one issue is with training, second is with the privacy maintained. The space in the sub-center, the space in PHC, that space is there in PHC, but not in sub-center. We are working in that. We are constructing one more room in our health wellness center. So
Right.
we give that these types of facilities to the community. Also, we have to see the importance. We have to look at the importance of this program, because we don't have any dedicated staff for NCDs.
Right. Right.
At CHC level and even at district hospital.
Right.
Now, if we talk about the epidemiological data of NCDs, 65% of total deaths because of NCDs. And we are working on that old structure in our department. There are a staff nurse who is doing all the necessary work under the doctor, right? In all the programs, ANMs already overburdened with the RCH activity, with the immunization, family planning, and other. Now we recruited CHO, so now we are very much hopeful that at sub-center level itself, in future, the screening, the real meaning of screening, will happen at the community level itself.
Yeah.
Then if we talk about the another problem, like Lalit sir was saying that now we have Chiranjeevi Yojana, we have packages, they are giving the free treatment. But treatment tak aaye to sahi.
Correct. Exactly.
And availability of cancer drugs also. Yes, we have enough impel drugs for the hypertension, for the diabetes treatment, but we have to also check out with the drugs of cancer.
Right. Right.
Referral system also, ma'am, one point.
Yes.
That we are actually in process to strengthening our referral system. It's a very weak referral system. When you diagnose and it's in some another level, you need to refer, you need to follow, to be in this circle.
Yeah.
So that if that will miss, then the chaos will happen. So we have to work on that also.
Right. Absolutely. Thank you so much, Dr. Arun. And in fact, you've given a very holistic picture of where the health systems in the state stands, and what is being done, and what exactly, where are we in terms of the gaps also. We have some point by Dr. Lalit, and then we will move to Dr. Rakesh. Sir, over to you, Dr. Lalit. Yeah.
Yeah. Thank you so much once again. I think Dr. Arun mentioned very, very relevant practical points and the ground realities of the national programs which are being run at the community level, at sub-center level. To me, it looks that if we provide mammography machines to all places, probably the things will not be resolved, because it is not the machine which is useful. It is the awareness and education of the common women which is most important. Take example of COVID vaccination. We all were scared when the COVID first wave or second wave was there. And then desperately, we all were waiting for the vaccines to arrive from Indian origin. And then the government had so much of promotion about COVID vaccination and the knowledge about COVID that everyone was knowing about the COVID safety measures. So same thing will happen with cancer if it is a government's priority. We do not have proper awareness campaigns about cancer, and we do not have the education in women. Previously, I worked with another cancer hospital where I continued for screening programs for more than 15 years. And we have taken a mammography van also with us in rural areas. And to surprise, not a single woman was coming to us for mammography screening. And the major reason was they were scared, they were not motivated, they were not prepared that what this bus will be doing with us. They all felt ये लोग आए हैं बस में पता नहीं बिठा के कुछ जांच करेंगे, कुछ उल्टा पुल्टा रिपोर्ट निकालेंगे, and then they will find some fault. So that was the reality. So awareness, education is most important. Another important point I feel that we do not have any package for screening. In Chiranjeevi
I think we have.
So 10 lakh rupees package is huge.
Yeah.
But we don't have any package for screening, that if somebody wants to undergo regular screening for cardiac issues, mammogram, pap smear, we don't have any package for that. So if insurance can have incorporation of screening packages, they will be saving money also, and the population will be much more healthier.
Absolutely. Thank you so much, sir. You made a very, very relevant point. And in fact, we will be taking that particular point in, in the next part of the conversation also about, everything that we have talked about. It has to be a government priority. Without that, I think it'll be difficult to see the kind of, changes that we are expecting. Dr. Rakesh, we will be coming to you now. So thank you so much for patiently waiting for us. So the reason I'm bringing you now is that, we've heard, while all of us, sort of work in the same ecosystem, but we've seen the government side of the story. We've also seen, medical side of the story as well. But your association with the Rajasthan Cancer Foundation is very significant, and that sort of puts you in a very significant position, that is, specifically at the interface of between patients and the medical treatment. So from the space that you represent, can you firstly, help us understand or share some light on the patient experience, of breast cancer in Rajasthan? And from that experience, how do you think the continuum of care can be strengthened for the patients?
Thank you very much. Good evening to all the participants as well and my fellow panelists. I wish to know before I respond, who all are the participants here in this webinar?
In terms of the audience?
Yeah.
We have a very diverse audience today.
Yeah.
Yeah.
Okay. So if I talk in general, I would say, since I have worked in government sector, in medical colleges, I have worked in private sector in Mahavir Cancer Hospital locally in Jaipur, and I have been also working as NGO as well.
Yeah.
My experience of nearly 37 years now in breast cancer control as such, I must say that where we need more reinforcement or thrust is enhancing the public awareness.
Yeah.
That is the most important aspect. And where we should have made more investment than doing the investments to create more cancer treatment facilities. That is first part. And I am saying this with my experience that if you go to Houston, where there is a cancer treatment center, a famous MD Anderson, there is a equally big building of cancer control. So what I am trying to say with this analogy is that if you wish to have control of cancer, prevention of cancer, a public health approach, you need to invest much more in the awareness, creation of awareness and advocacy for it. Where we are missing, therefore, and we have been missing, earlier we had the National Cancer Control Program. The funds were hardly utilized, not only in Rajasthan, but in other states also. Now we have NPCDCS. I heard Dr. Arun about it. There are challenges. I do not disagree with it. I also feel that government is the only hope. Government health system is the bigger hope or the only hope we have where we could bring about a change.
Yeah.
But have we thought of discussing it with the collaborators who are working for over 2-3 decades in talking about and assessing the impact of or the reasonably the value of mammography or screening in the breast cancer? The views are diverse, but predominantly we are not at that stage where we can spend a lot in the screening. So I fully agree with Dr. Arun that we need to perhaps empower our Anganwadi workers, our ANMs, more into creating public awareness about the breast cancer, which in simple words, perhaps for a woman, would be that if you have a breast swelling, come and report to us so that we can give you an opinion whether it is a cancer or not. But before that, they also need to understand what cancer is.
Yeah.
There are many people who are afraid of cancer, as with my intensive experience, much more bigger experience in tobacco control, where the pictorial warnings are coming on all tobacco packets that this is the oral cancer, and people just ignore it. What I wish to say is that we need to create an awareness in the people that what cancer is, and if it happens, what will be the consequences, and how can we prevent with something like simple breast self-examination or maybe breast examination by a nurse, which is more credible than the self-examination evidence-wise. The strength of evidence suggests that a physical examination by a health worker, nurse even, is much more effective and more has a more positivity rate than the self-examination. But nonetheless, in this country, I think even self-examination will be a good way to begin for detecting a breast swelling. And then we need to remove this myth that putting in a needle or what we call as FNSC test to confirm whether it's a breast cancer or not is not going to affect the woman in any way, or if this is a breast cancer, it will not be the cause of spread. So my emphasis with all this experience is that we need to put in more resources with sustainability in generating higher awareness for the breast cancer. We need to perhaps, or as it is observed many times on the international platforms also, that whatever we have done in the cancer treatment, it suffices. We need to spend more in the awareness and advocacy for early detection of the cancers, breast cancer, cervical cancer, and oral cancers. So government is going in right direction, but perhaps it needs to rethink about the investment of the resources, the role of IEC, and it's not only training the nurses or Anganwadi workers once. We need to assess what has happened to the training component. Have they been adequately empowered? Because if they have not been adequately empowered, will they be able to carry out the role which has been given to them with responsibility? The quality of care, even in creating an awareness, is also very important, as it is even for the physical examination of the womb. And as Dr. Arun has very rightly said that, yes, there are a lot of socio-cultural issues, the acceptance related to the acceptance of the screening program, the cost of the treatment, all these will definitely have to be responded to. So I think we need to perhaps think a little differently. We need to sort of rediscover as to what we require to do versus what we are doing now, and what impact it has. We need to set the benchmark and perhaps need to assess what we are doing every year to year. I consider one of the biggest deficits Rajasthan has is that it doesn't have a cancer registry, even hospital-based cancer registry in the cities where it is the treatment and cancer centers are there. The owners of the cancer centers are also not interested in preventive work or public health work related to the cancer control. That's the challenge.
Yeah.
And government has to come forward that we will have the registry, at least hospital-based registry, at least for the major cancer centers, to know what is the burden of the cancer. We don't know that. So, I mean, it's good to have the Chiranjeevi scheme or Ayushman Bharat scheme, but perhaps we have not really reached to the stage where these schemes will be very useful. I also tell my oncologist colleague, now that I do not practice oncology as such clinically, I have always told them that do not go for the cancer camps. Go for the ward-based approach in the cities where you are for screening the women. Try and see, learn it from it. What do the women want? How can you reach out to the women? What will happen if you have reached out to them? Will it give you the desired results or not? So I think those are some of the issues which I consider with my experience are worth pondering on as to how should we go about the prevention of the breast cancer and its overall management. I hope I have made the sense.
Absolutely. Thank you so much, sir. And I think I agree with all the points that you've made. I cannot, disagree with any of those points. And in fact, what you said that, we have to think a little different, and you gave COVID example as well. And I think right now today, I am discussing about breast cancer with three men who are representing currently, the state of Rajasthan. I think this is a different thinking in itself, women, I mean, the kind of stigma and the shame which is associated to, breast cancer. And as a result, women do not, even they're not comfortable coming out for
Can I
diagnosis,
just
talking about.
interrupt to
Yes.
say one thing? We need to assess, and this is for Dr. Arun, survey the women doctors. How many of them have had the breast self-examination or mammography? Their knowledge, their expertise, did they ever have it? Have they been thinking about it? What has been their thought mostly? I know with my experience of working with the women colleagues, none of them are interested. They say, होएगा जब होगा देख लेंगे. अभी कुछ नहीं करना है. I do not want to have it. So that's why I said, find out what women want. This is a very big socio-cultural and economic issue as well.
Absolutely.
Yeah.
Sir, I have two updates basically. One is that before 4 months, we have signed MOU already for cancer registry with the ICMR Institute, private and government as well, who are doing diagnosis or treatment for any type of cancer. And 69 out of these 135 hospitals have already registered for the ICMR NCDI website. In next 2 months, we are very much hopeful that our cancer registry system work in full-fledged manner. All the cancer patient will be the data of all the cancer patient, that particular form should be starting to submit to ICMR NCDI for the data management basically. So we are in this phase. We have done with the MOU, and in next 2 months, full-fledged cancer registry will start, sir.
Two things: adequacy of resources and sustainability. These are two very important aspects. I am telling you with my experience of working in Muscat, Sultanate of Oman, which had a population of less than 5 lakhs at that time when I was working in 90. For covering 4 hospitals, they had 5 full-time persons. So human resource is very important to be successful in cancer registry. It's good to have MOU, but reassess your human resource, whether that will suffice, because the people have to move from hospital to hospital on a day-to-day basis. That's very important.
Yeah.
They should not be missing the cancer there.
I will do it, sir.
Or unless it becomes a notifiable disease.
Yeah.
Second thing, sir.
Yeah.
We are starting for giving the 5 days module training on cervical cancer screening, basically visual inspection with acetic acid and breast cancer in AIMS Jodhpur and Mahila Hospital Jaipur. Also, we have tie-up with all the medical colleges, sir, in last 2 months, and more than 150 female doctors. On priority, we are giving female doctors for training. All the female 150 doctors of the Rajasthan government, we have trained them. We are also following the follow-up, sir. Last month we did the VC with all these female doctors. Then what happening with the after training? What happening? Are you able to doing the cervical cancer screening, breast cancer screening, and all these things? They tell us of resolving these issues, and we are very much hopeful that in coming financial year, we able to train all the female doctors as well as staff nurse for breast cancer and cervical cancer.
I'm not satisfied at all with the process that you are adopting. Unless you have a robust data collection mechanism, you will never be able to know how many are prioritizing cancer cervical screening or breast cancer screening. This is my humble plea to you, that you need to rethink about the women doctors you have trained, because they are all clinicians, they are all practicing gynecologists and obstetricians. A lot of time goes in other things. So how will they be able to prioritize cancer cervical screening? I wish to know, because I have been associated with NCRP of ICMR. I have been associated with cervical cancer screening program of WHO at the Lyon, France unit, AR. I am telling you that we need to revisit. We think
I
about
think
it.
currently we are in that discussion of, looking at the elephant and which side are we looking at the elephant from. And I think
I'm
all the
trying
points,
to,
I think, yeah, sorry,
I'm
sir.
just trying to bring it to a micro level where it is required.
Absolutely, absolutely.
We have been doing this for last over three decades. At the national level, at state level, we have not succeeded. So we should not be using the same methods which have not given us the success. That is what I wish to say. Technology has improved, commitment has improved, and resources have improved. I think we just need to perhaps think in where we can bring the breakthrough into the processes.
Definitely, I think you're absolutely right. And where the government currently, I think, is focusing is, in the system strengthening part. And what I think is getting missed right now is that it has to be also a population-based demand for specifically for screening of breast cancer. Because, and I think the roots of that also lies in, breaking the stigmas, and not just amongst the women. I think it's a population at large, which is not gender-based. Men and women have to be equally, aware about the intensity of what a breast cancer can cause. So, and I think also, with the kind of demographics that we are looking at, the age where breast cancer is actually, occurring right now, it's a fairly young population. And I think making that sort of behavioral change kind of, aspects or policies and programs for that particular population, and using, the information technology for that particular population is relatively easy. And I think those are the ways that where we need to sort of relook at, when it comes to, building more awareness, for breast cancer. But also we have been, also talking about making cancer a, government priority at the national level, also at the state level. But in that aspect or in that segment, do you like it's an open question for all three of you, that do you think making cancer a notifiable disease would be, of relevance here? Lalit, sir, we'll start with you.
Yeah, thank you so much. So I think we are discussing a very, very relevant point, that should cancer be treated as notifiable disease? The answer is yes. In Punjab, we have seen that. And if it is a notifiable disease, we will have the real data, and we will be able to focus that which part of state has got which type of cancers. Like maybe one particular part having gallbladder cancer, one part may be having breast cancer, some part may be having stomach cancer. So we will be able to identify and map the disease statewide and various district-wise also. So that notifiable disease, to me, remains one of the best things if it can be done at government level.
Yeah.
Sir, it has already done.
Sir, but in ground reality, we are yet tempted to see.
It will take some time. I just, as my senior, sir, and
yes, sir,
would like to request you that whatever we are doing at government level, at a very big level, and all the disease we are, it will take some time to do some impact, sir. When I joined 4 years before as a SPO NCD, the doctors don't know what is the NCD program is all about. Yes. What is the NCD? But right now I can assure you, sir, if you go in the PHC of a Jaisalmer district, Karoli district, and Hanumangarh district, and you ask what is a CBAC form, sir, what is a form 5A, 4A, what is the breast cancer screening? If you go to the ASHA level, they will tell you, sir.
That's great. Salute to your dedication.
Yes, I can assure you, sir.
No, definitely. I think any progress is also, time dependent. Yeah, definitely. I think it's a progress that is time dependent, and if the right intention and if the right programs at the level of government are in place, I think slowly we have seen it. I think, like I was saying in the beginning, the government, at least on the maternal child health, Rajasthan has done remarkable, has achieved remarkable success. I think a lot of programs of the state government have been adopted at the national level as well. I think the same thing, I think when it comes to health system strengthening, the government's focus is there. But I think, again, coming back to the point of screening and early diagnosis, which is a key aspect here, it is one thing which is just not only dependent on the medical side, on that side of the demand level. It's a very population side of the aspect as well, because there has to be an adequate demand from the people, itself. And I think COVID was also, one similar example there, that, we had, vaccines available. There's so much of hesitation in the population that made, delivery very difficult for quite some time. And there, the information communication campaigns that, played a really important role. So, in from that aspect, we have been, talking about it being a notifiable disease as well. I mean, that is one aspect of it. But where do you think, the role of these behavioral change programs also lie? Because no matter how much system strengthening happens, if those behavioral change programs are not implemented, and if not, this has to go in parallel. If that is not implemented in a timely manner, a lot of resources might get, wasted in the time. So, Dr. Rakesh, Dr. Charun, over to you for that.
Yeah, I fully agree with you, Dr. Nalini, that it's a behavioral change. And unless we have proper behavioral change programs and right kind of communication and the knowledge as to what do the people want, the people at the population level, do they want cancer control? Do they want early detection of cancer? Do they what is their priority? We have not been hearing anything of this kind at the popular media level, whether it is TV channels, whether it is social media. Do we ever talk about it? No, we don't talk about it. And I think that is where it's a mammoth task for the state government. I fully agree with you. So, Dr. Arun, I may be very critical of what is happening at the government level, but I also know that it is not very easy with the minimal resources at hand and with the very scanty human resource that you have at your hand. But it is very important that the government, the people in the government has to realize, those who are in the governance, the APHS and the health minister. And I have been participant for nearly 2.5 decades at the state level. But what I have always felt, and it's not only for me, but several of my mentors and senior people, they say that we have stopped going to the government meetings because nobody listens to us, what we are saying. That's a big challenge. But I think that is if you will look at even at the references, the key references coming from apex cancer centers, like what I have put here, you will realize it is the awareness which is required, and awareness only will change the behavior. That is the key. If we wish to increase the participation and proactively do that, which becomes mutually beneficial, I'm saying mutually beneficial, considering that the benefit is not only of the hospitals, but also of the patients. It's very important that we focus on what is not changing, why the behavior is not changing. What are the inputs which are required in changing the behavior of the people towards a healthier life, towards a cancer-free life?
Yeah. And
it is preventable disease. I think I still remember the 5 adages which I had learned in Tata Memorial Hospital way back in mid-90s. 1/3 of the cancers are preventable cancers. We have not been able to do that. We are saying, oh, cancer is increasing. But why it is increasing is because we have not been able to work on the preventive aspect, the major risk factors, the screening programs, the awareness. I think that is where the key lies.
Yeah. Definitely,
So what
Dr.
I believe
Rakesh,
since the inception of this program that can coordinate, and we are doing so, that we can coordinate with the school health programs.
Yeah.
Awareness programs since the school and college girls before marriage. We can tell them, and A&M at the ANC MCHN day, we can aware them about the symptoms and the benefits of early screening and how to do self-breast examination for the breast. That can also do some wonders.
Absolutely. I think I have one point to make sure. Sorry, sir. Before that, I think I would just like to make one remark, and this is not the feminist in me talking. I think when we talk about school health program or any such program, I think the focus is not only be women. We can teach girls and women about breast examination, but what is breast cancer and the larger awareness and about early screening, it needs to be taught to everyone, irrespective of their age and gender. So, that will also help us understand people are located at various levels, not in schools, not only in schools, in fact, in various other places. But I think it needs to be a very holistic program. And that is the kind of shift in the mindset I think we are talking about. That's the only point I want to make. Over to you, Dr. Rakesh.
I'm saying it's an easy escape to go to the schools for creating an awareness about cancer. Cancer is not a disease for the childhood or adolescence. I think going there for tobacco control is fine. There is a tobacco control program which is going to the schools called TOFI, the Tobacco Free Educational Institutions program, which is fine. But for cancer control, I think the need is to go to the workplaces, need is to go to the universities, need is to go to the hospitals. That is where the population which is coming, even if you do the opportunistic screening, you need to focus on the hospitals, the adult population, which is in the middle age, from 40 years to 70 years. That is where you need to focus when you are thinking about breast cancer specifically. That is where the guidelines are. What we need to do, we need to create displays. We do not have in majority of the hospitals the information as to what is required to be done for prevention of breast cancer. What is breast cancer? When should the screening be done? When should the mammography be done? We need to have more trust in IECs. That is what I'm trying to say.
I think, you're absolutely right. And I think definitely, I think it's established that a shift in the mindset really, needs to be there. Government is definitely doing a lot of, in this particular space. But after learning from COVID and after learning, from many other experiences, specifically in the case of cancer itself, I think we need to sort of reflect and, need to upgrade, what strategies are we sort of putting there. And also, I think, like, sir, you said a while ago that cancer, most of the cancers are preventable. Breast cancer is actually a kind of, or is a type where treatment is available.
Yes.
As opposed to many other cancers, we have treatment. So the likelihood of a patient recovering and going back to almost a normal lifestyle is very high. But all of that, the only crux, here is about early screening, which is also again dependent upon the motivation factors of many, or actually all the stakeholders, who are in discussion today. I think we are, we have like sort of positive time. We might have to close the session, but I think one last question to all of you, that we have talked about what the government is doing. We have talked about, the landscape and what is the need of the hour. But I think it is also the time where, a lot of private and public sector partnerships needs to be seen, because with government doing it alone, I think it's better always that, when it comes to health systems, the private and many other stakeholders, who are similarly placed and doing similar kind of work, have a lot of successes, in the similar space, come together. So, last closing remarks from all of you, specifically on PPP models and also, broadly in the space of early screening for breast cancer.
So, if I may go first, let me say that collaboration is the key. Yeah. Government should not act like big brother, but it should collaborate with all the private hospitals and private centers or private health sector across the state and the country. We need to think again as to how private sector can participate, because private sector is nearly 70% of the entire health sector. And we need to set the policies right, which may not be acceptable initially to the private sector. So these have to be thrust also on them. It may not be a win-win case or a good business model for cancer control as such. But I think it is in the interest of the public that we must have some kind of mechanism. And I wish to confirm with Dr. Arun that has Rajasthan government made an order that cancer is notifiable disease? I am not aware of this. If it is a notifiable disease like COVID, then it will definitely be put on the priority by the private sector as well.
Yes, sir.
Is it a notifiable disease?
It is a notifiable disease, sir. I will share the documents.
No, it will be available online also. I will be able to see that. Yeah.
Also, we are trying to have a workshop with the big private players, big private hospitals.
Okay.
And those to work on it, sir.
Okay. Great.
Dr. Lalit and Dr. Arun, over to you for the last closing remarks.
Yeah, so once again, it's going on very that includes government, non-government, private hospitals, individuals, education institutes. We all need to come together to fight against this. It's like a महायज्ञ. And जब भी कोई महायज्ञ होता है, हर आदमी को अपनी तरफ से आहुति देनी होती है. So maybe at organization level, maybe at individual level, college students' education part is one of the most important part, because these educated girls, they can probably highlight the things in a better way to their mother, sister, and the community. Other important part about breast self-examination, like Dr. Arun has mentioned, that even if we teach our women about breast self-examination, they will be able to find out any abnormality in their breast, so that opportunistic screening can be offered. And again, media and government, they again will play a very, very major role in fight against the rapidly increasing cancer. Of course, we cannot prevent, but we can bring down the mortality to a significantly low level. Thank you.
Thank you, sir. Dr. Arun, over to you.
Well, first thing I would like to say that we are in desperate need to inter and intra-sector coordination. As Rakesh sir said, I fully agree with the private players, what to do, what not to do. Second thing, we have to evaluate our program, that what we are doing for the treatment and awareness, and basically for the prevention of breast cancer, are we on the right track or not? Because from 10 to 6 job, we are doing all the hard work and all the things, but still we are going in that process which is result oriented or not. At the end of the day, if we think after 4 year, 5 year, what the trainings and what all that we are doing, and at the end of the day, but the no result is there, no awareness is there, and nothing is coming. So we have to recheck our activities, what need to be do, where should it be emphasized, what activities we should emphasize, where should we work actually, on treatment side, on demand side, on awareness side, what should we do, and what should we can avoid also. We have to work on. Dr. Rakesh sir is there. Sir, I request you that we can have a meeting also in the department, and we are lacking, because when it's a mind of 1, 2, 3%, my nodal officer, joint director, and me, what the limited knowledge and what we have, what the guidelines said, we are working on it. We are working, doing proper monitoring also, but sometimes at the level of the guidelines and policy level, we need to also work there.
Definitely, and I think that's sorry. Yes, sir. Yes, Dr. Ravan.
Because just like when I always think, like the government of India said, PAP smear बंद करो, VIA पे आओ. पर PAP smear बंद करके और VIA पे आने पे आपको कितना टाइम लग रहा है, कितना रिसोर्स आपका जा रहा है in terms of money and other thing. And उसके बाद भी अगर VIA डॉक्टर्स आपकी नहीं कर रही हैं, then we have to think over it. We have to think over it. Second thing, my third point is we have to work on our resources. Government में resource create करना in terms of money, that is easy, but in terms of human resource, it is very, very, very much difficult. We have to know the particular integrated management. We have to work with the integrity to combat this particular disease. We also need to work with that. We cannot have a different doctor or nurse for the breast cancer, even for the NCDs. I was telling you, आपके पास ANM है for the RCH activities and all the things. आपके पास एक staff nurse है, but now the non-communicable disease के अपने patients हैं, with all non-communicable disease. ENT के patients हैं, all the non-mental health के patients हैं. Yeah. So we have to think, and we have to give suggestion that if one more nurse can manage at the PHC, CHC level for all the NCDs diseases. So that is also need to be think.
Right. Thank you so much, Dr. Arun, for your closing remarks as well. And thank you so much to all of you. I think it was really great to see that, the intentions, are rightly placed by all, the stakeholders and by the government as well. And I think cancer is a kind of disease where everyone thinks that it's not going to affect me, but it might affect the person sitting right next to me. And I think it's also a disease which does not discriminate, across the age, across the gender, etc. So specifically then when we talk about breast cancer, I think really need to, sort of rethink how we are strategizing early screening, how the information behavioral change programs are also being designed. And I think that that's really the need of the hour, because it is a type of cancer, like we talked, that it has treatment available, and if the early the diagnosis and the screening takes place, better are the chances for the survival of the patient. So I think with the beginning of this particular discussion, today we were at the beginning of the discussion, and I think it was really interesting to see various points, but standing together, across, in the same spectrum of the discussion or the topic that we had today. Thank you so much to all of you for joining us today, and we will be looking forward for future discussions with all of you. Thank you so much.
Very
Thanks to you, ma'am, and thanks to Rakesh sir, Lalit sir,
Pleasure.
for guiding me. And I think that we can, in government, has all the hopes, and with the government, that government is a big, government is the elephant actually.
Thank you.
So they
Thank you so
can
much,
bring the
Dr.
change.
Arun, for
We are
Thank
doing
you.
our best, sir, and we will work more